One. Welcome to South Charlotte Sports Report Live. My name is Tripp Roakes, and I am so excited to have with me tonight the Mecklenburg County Health Director, Ms. Gibbie Harris. How are you doing?
I'm great. How are you?
Good. Quick question, though. 3 months ago, you were kind of like, you were off in the shadows doing your job, everything else. Now, all of a sudden, you're the most popular person in Mecklenburg County. How does that feel?
Well, I don't know if I'm the most popular person. I would imagine that there are a lot of people that have seen me, but I'm doing okay. Doing okay. It's a new day every day. One of the main things we've learned about this virus as we move forward is what we don't know about it.
True.
True. So every day we're learning, and every day it changes to some extent how we have to manage and react to it.
It's been something else, that's for sure. Let's get right into it. I think the biggest question, the biggest misunderstanding that I get from people, and I have myself, and Dr. Cohen cleared it up a little bit, but can you define, because this goes with everything, can you define socially distancing and a gathering, the difference?
So, technically, one of the three things that we really want people to pay attention to is social distancing, physical distancing, whatever you want to call it. But that's really staying 6 feet away from people, if at all possible, right? And a gathering is a group of people who are going to be close together in some way. And what we want is, as much as possible during that time when you're gathering, you continue to keep your distance, because we know how the virus is spread. It's spread from droplets from one person to the other. And so when you're in a packed situation, obviously the opportunity for that virus to take full advantage of that is huge. So the more people can be at least some space away from others, the less likely they're going to be infected, or they're going to infect someone else. And you can socially distance while you're gathering. Does that help?
Socially. Let me throw an example at you.
I know.
All right. I'm guessing this is how Harris Teeter and stuff are operating. Obviously, they got way more than 25 people in the store.
Yes.
But really, none of those people are within 6 feet of one another. I know I try to stay, I'm kind of eerie about that, and I try to stay 8 or 10 feet away. So really, that would not be a gathering, even though there's 150 people in the store right now, or from that example, right?
Mm-hmm.
Or if
and the guidance around businesses is a little different from a mass gathering, is sort of the language that we've been using. So a business, the guidance that has come from the governor around businesses is that it has to do with the fire code and how many people are allowed in that building. And what they've asked is that you not exceed 50% of the number of people that are allowed in that building. So obviously, in most cases, that's going to be more than the 25 outdoors, the 10 indoors for mass gatherings. So the guidance for businesses is a little bit different than just when you're in a social setting.
I probably should, let me bring it to a sports situation then.
Mm-hmm.
Let's say we're at a softball field, and 2 teams are playing,
mm-hmm.
and that organization has done a great job of marking off, putting X's, just like we see in Lowe's and Home Depot and stuff, and keeping everyone away, maybe making the fans be 10 feet apart on the outfield fence or something of that nature. That would not be a gathering because everyone is spread out, correct?
Technically not. However, I think the way the state is defining that mass gathering, they're probably looking more at the number of people than they are whether they're 10 feet apart, those sorts of things. When it comes to sports, at this point, as I'm understanding it, because the guidance is like everything else with this virus, it continues to change.
I agree.
and be modified and shifted, and people question it, and there's some adjustments to it. So stay tuned, and it'll be different tomorrow.
Exactly.
But I think the thing about sports is you don't want hundreds of fans in one place. So they continue to talk about And I continue to talk about the mass gatherings when we were talking about sports, right?
And for instance, I know you probably saw the photos from Ace Speedway down in Alamance County.
Oh, yes.
That's gathering. They weren't separated. I am fully.
Yeah.
They should have been. I agree.
Yeah.
But, let's say that we're at a softball, baseball field and you've got the kids playing and they've got them spread out in the dugout and down the baseline. And, I've seen all the plans that different folks have for doing it and, with adults supervising it and all that. That, and then, keeping the adults away, but, mom and dad there to watch their son or daughter play. But again, everyone massively spread out over a 4 acre situation, which probably a full-size baseball field is. That's where I guess people are making sure that that's different.
Yes, and it's again, it's nuances. It's hard to parse these apart because you really you don't want hundreds of people in one space because we're social beings, right?
Right.
You get that many people in one place, it's going to be hard to keep them apart for a full ball game. They're going to get excited. We're going to start looking at high fives. We're going to look at hugs. We're going to look at all kinds of things that we prefer not to see in settings like that just because of the potential for exposure. But I would parse out probably the kids on the field and the people in the stands. So you're not looking at 25 total with that situation.
Oh, of course, yeah. And Dr. Cohen told me that as well. She was very, I think she agreed with the way that I presented it anyway.
Yeah, and
I was a big fan of being outside. I think we're going to be surprised as things get going back the way that most common level-headed people will behave around this. I know there's idiots out there. I saw 10 of them, 10 adults playing basketball on a neighborhood full court in my neighborhood the other day. And I was like, oh my God, there's no way. That's your issue. It's not being on a 4 acre field or whatever spread out. But I think you've given good guidance there. Let me move into some other kind of neat kind of questions. I think, let's talk about your decision last night, because I've gotten my email boxes blown up over this, to ban organized sports at county parks like Renaissance Park and places like that have ball fields, have soccer fields, things like that. You essentially banned those from happening. I think the directive said unorganized sports, okay, organized sports, can't do it. Correct?
Well, I actually had a conversation this afternoon with our Park and Rec director, and we'll be putting something out from the county probably pretty shortly, clarifying some of that. What the county has decided not to do is to allow for sports teams to reserve fields, right? That doesn't prevent them from using the fields if nobody else is on it. So if you have a sports team that you want to take out and practice or even have a game, and the fields are open, there's no one that's going to stop you from using that field. We don't want multiple teams, obviously, out there fighting over a field. That defeats the purpose. But right now, the county is holding off on moving towards reserving fields. And there's a couple of different reasons for that. But one of them is we are just now starting to bring some of our staff back in, because the county has had quite a bit of staff who have been working from home, teleworking. We're still doing a good bit of that because we don't want all of our buildings full right away.
Sure.
So the Park and Rec needs to make sure that they've got sufficient staffing to do the things that they need to do. And making those fields available for reservations right now is not high on the list.
Right.
They're looking at what they can do in terms of summer camps for kids and things like that. And that's really sort of where the focus is right now.
Yeah, I believe the frustration there it comes from at some of the county-owned parks, which are different from CMS-owned parks. Recreation associations had hoped to resume their spring season, and this essentially said, no, your season is over. which I'll be honest with you is going to cause an incredible financial deficit for a lot of those folks.
For
And
some of those
we
folks.
can only pray and hope that there's enough dollars left to come back in the fall under that situation.
Well, now I do know in having conversations with Lee Jones, they are looking at maintaining that possibly through the end of June.
Mm-hmm.
So it may be as early as the 1st of July when they might be able to reserve those fields.
Okay.
You know, and again, we're watching the data, we're seeing what's going on in our community, and we're making decisions based on that. So things can change. They may get better. We hope they get better. Or we at least hope that we can keep a little bit of a lid on this virus, which I believe all the social distancing that our community has participated in has really helped us do that. It could have been much worse at this point than it has been. So we're continuing to watch that, and as we can modify and open things up, we will.
Yeah, I guess that's kind of what struck me as well, because I've been in these parks with my child playing baseball games and tournaments and things like that, and I've seen the unorganized play on some of the basketball courts, soccer fields, things like that, and I'm like, you better find a way to control that, because that's where your real issue is, to be quite honest.
It is where the real issue is.
Talk about your decision to some of it's your decision, some of it's the state decision, but pools reopening. I went to a pool this weekend, neighborhood pool, large neighborhood pool, and their capacity normally is 500 to 600. So they were governing off of like a 250 to 300. So 200 people at a neighborhood pool seemed a lot, but they were following the rules.
They were following the rules, and those were again, those were rules that came from the state. What we know, what I would suggest when you go to a pool, stay in the water. because the chlorine takes care of the virus, right? You're safer in the water than you are sitting out on the deck with all the other people. And we hope that people will continue to social distance even when they're sitting out. And when you have 200 people around a pool, that's a little challenging to do.
I agree. And I think that's where the frustration comes. Okay, you can do it at a pool, and we can't get a straight answer on what we can do at a softball field. And there's the softball being all the way outside. I think, and I promise I didn't really mean to editorialize here, but I think that's probably where a little bit more work may need to be done on straightening out some of the guidelines. And I know you're open to that without a doubt. Mm-hmm. And listen, you put all this stuff together, and you can't think of everything, and there's a different situation around all of it. So I understand that. Let me move into another area. It seems, and in talking to some folks in this industry, a lot of outbreaks right now outside of the nursing homes. The big outbreaks seem to be happening on large job sites, and crazy numbers. When you see something like that, are these job sites shut down for 2 weeks, or what is that's the part I think is really skewing the numbers a lot, maybe.
Well, that's part of it. That is part of it. It's not all of it. There are a lot more people being tested right now.
True.
For any number of reasons. So what we are seeing is some issues with some construction sites. Obviously, that's one place. And we've been working with construction sites across the county to make sure that they're doing what they need to do to protect the people that work for them. It's a little challenging because there's lots of subcontractors and subcontractors that have 5 or 6 guys that work for them. So continuing to work on that side of things. But the other challenge that we have are businesses where there are a lot of staff working together. You've heard about the Tyson chicken place.
I'm a Wilkesboro native, County. And I saw that you used to live in Wilkes County. So
I did. Yeah, I did work there for a while.
Yeah.
And that I don't know if you've ever been in that plant, but people are side by side. Yes. There's not much opportunity for social distancing or anything for that matter. So those types of facilities, we're paying attention to those in Mecklenburg County. We don't have anything quite like that plant here. but other places where frontline staff, essential workers, are sort of forced because of the type of work to be in very close contact with each other. And we're trying to pay attention to those because this is where people can really be exposed, and
Right.
lots of people at one time can be exposed. So continuing to do some of that work. You used the word common sense earlier, I think, or implied common
Yes.
sense anyway. What we need in this community is for the community to continue to do the things that we know make a difference. And there's simple things, there's the facial covering if you're out and can't social distance. There's the social distancing, and there's washing your hands. Those are the simple things.
Right.
We can all do those things. We need our community to continue to do that. But we also need our community to use each individual to use good common sense. Don't put yourself and don't put others at risk. And we'll get through this together. So I think
I agree.
That's what we're looking for. And we're doing that not just with individuals, but also with our businesses, and making sure that they're protecting their employees as they come back to work.
That's probably, you're exactly right. My wife and I walked inside a restaurant with the intent of taking it out onto the patio to eat the other night. And I think there were 8 employees. 3 of them didn't have masks. 2 of them had the mask like that, not covering the nose. And we just said, after sitting there for a minute, like, this is crazy. And these people are functioning and allowed to make money. I said, it's like, no, I'm not. There's something not safe about that. So at that point, you have to make your own personal decision. And
exactly. Yeah. Don't put yourself in a situation that's putting you at risk.
One last thing I really want to talk about. I've talked about this to the community as a whole from the beginning. I'm very worried about the mental health, not just of student athletes, and the spring student athletes have just been through some terrible stuff, but adults as well. I saw a study today that said 1/3 of adults and children could be classified as showing signs of clinical depression due to the virus. What are you seeing in Mecklenburg County? What's in place in Mecklenburg County? And what is your advice to not just moms and dads that see stuff, but friends that may see it happening in other adults?
So, this is a tough time for everybody for lots of different reasons. Number one, there are a lot of people that are incredibly fearful of this virus and what it can do to them if they become ill. So that right there is plenty of stress for any one individual. But then you add on to that whether they can work, whether they can pay their mortgage or their rent, whether they can access food, the whole issue of the food chain and whether food's available, and having kids at home, not being able to get them out and about and socializing, worrying about your children, parents who are trying to homeschool. That's stressful in itself, especially if you don't understand math these days. So it's compounded daily with all the different things, not to mention all of the news all the time that is nothing but COVID. I mean, that's all we're hearing about these days.
Very much so.
And so, we've got to be aware of our surroundings. We've got to be aware of how others around us are doing. But even before that, we've got to be aware of ourselves. We've asked people, do your own physical check. Are you feeling well? Is something bothering you? Are you having difficulty breathing? Is there something going on with you physically that you need to take care of? Make sure you're taking care of yourself. But we need to say the same thing from a mental behavioral health standpoint. Check in with yourself. Are you stressed? What helps you relieve that stress? If it's going out and going for a walk, then make that a priority. If it's going to a ball field and hitting the ball with your son or your daughter, do that, whatever it takes. And as the weather gets better, people being outside is one of the best things for us, from a mental health standpoint. But as you're paying attention to yourself, pay attention to those around you. And if you see people are struggling, what can you do to help them with? To help them get through it. Whether that's just a listening ear, or a recommendation that they might seek help because they really seem to be struggling and having trouble. So I think we need to be aware of ourselves and aware of our surroundings and the people around us, and giving people the opportunity and yourselves the opportunity to find somebody to talk to, whether it's a neighbor, whether it's somebody in your church, whether it's a professional, if you feel like you need more help, but making sure that you go for that and that you seek it. There are a number of different resources out there on the web, the county website, as well as some Cardinal has some resources out there that people can access if they need. And there are quite a few entities that are doing virtual behavioral health these days.
Right.
So if you just need somebody to talk to, they can set that up so that you're not having to come into a setting to have that done. But I think awareness is critical. We all need to pay attention to ourselves and to each other.
I fully agree.
And provide that support.
And tonight at 8:30, I have the Atrium Hospital Director of Psychiatry joining me to go more in depth about what you talked about.
Mm-hmm.
So we have to do those kind of things. One more question. What, knowing that schools are scheduled to start in about 2.5 months,
mm-hmm.
What in the world is going to happen with this virus for anything to be close to normal for a 3,000 seat high school to begin?
That's a good question. I'm not sure we have the answer for that. We've been working with the school system, having conversations with some of the other schools in the community, the private schools. All of our schools, the main recommendation I have for all of our schools is to have contingency plans.
Oh yeah.
We don't know what the fall is going to look like. My hope is that kids can get back to school and things can kind of get back to normal for children. The best thing for them right now is routine, having some sort of routine daily, and school really helps with that. So hopefully at least some semblance of school back in person, in seats, in schools is going to be able to happen in the fall. Whether it can be a full 3,000 students at one time, or whether it has to be split up in some way, I don't know yet. But the schools are doing a really nice job of thinking through, looking at their classrooms, figuring out how they can help students social distance, what they do with meals, how they manage all of that. So they're working hard trying to get ready for that, hoping that we can make it happen. And I know we're all hoping that we can make it happen.
For sure.
That's, one of the best things we can do right now is get kids back to learning. I mean, and that will help our parents be able to work because the kids are in school. That will, and that'll help our children, and that really needs to be a major focus for us.
Help with the mental challenges we just talked about. Well,
Absolutely.
leave me with this. Leave me with our watchers, viewers, some sort of message of hope.
So I guess here's what I'd say. This community has done an incredible job of taking care of itself. I remember looking at the initial numbers of what we expected to see over the last couple of months, and it scared me to death.
Aren't you glad
we
that's
would not
not
have
being
been
wrong?
I know. We couldn't have dealt with it.
No.
We didn't have the resources in this community to deal with it. We asked the community to help with this, to be part of the solution, and it's worked. So I think the words of hope from me are that we have a community that comes together when they really need to, and can be resilient, and can come out of this in a very good place, learning more about ourselves and about what we need to be paying attention to and how we need to be pulling together to help make everybody in our community as whole and as supported as they need to be. So I think we have the ability to do that. I think we've proven that over the last couple of months.
We just need this virus to cooperate with us, right? Thank you
Yeah.
so very much for joining us, Gibbie. I really appreciate
Absolutely.
it. Nice to know you, and you know, I know that you want to do the right thing, and I think kids just want a routine and back doing the things that they love. So call it a night, hopefully, and enjoy yourself. Find a book to read or something good to watch on TV, or just get a nice, relaxing night of sleep and go back at it tomorrow. But thank you so much for joining us here on South Charlotte Sports Report.
I enjoyed the conversation. Thanks for having me.
Have a great evening. Thank you all.
You too.
Good night.
Good night.